starting your route to retirement.
As always, thanks for listening to the Guided Retirement Show. I'm your host, Dean Barber, founder and CEO of Barber Financial Group, and we know that there's thousands of podcasts out there you can listen to. We appreciate you choosing the Guided Retirement Show podcast. This week, we continue on with Tom Allen, Medicare expert, Medicare supplement expert. If you missed episode 6 of the Guided Retirement Show, make sure to go back and listen to that. In fact, I would suggest that you listen to episode 6 before you listen to episode 7. We laid out some of the highlights of, what is Medicare, what's it designed to do. We're going to get into more detail with Tom Allen on everything about Medicare and Medicare supplements on this part of the Guided Retirement Show. Enjoy. Okay, let me ask a question. From an employer standpoint, we're going to get off of Medicare here, but this whole health insurance thing to me is fascinating, and there's so many different nuances and if you don't know some of these things, you can really get caught in a trap.
Oh, absolutely.
So let's say that I am that 65-year-old that is still working, and I've got a copay, and let's say that my copay is $200 a month.
Okay. Common.
Well, if I could go to Medicare and get on Medicare at 65, where my premium is $135.50 a month, that's less than my copay. Would that employer not look at Medicare as the number one and that their policy then as a supplement to Medicare? Wouldn't they be better off too?
Depends on the size of the employer. If the employer has 20 employees or fewer, then their health plan is going to be primary and Medicare will be secondary. If they have more than 20 employees, the opposite's true. So
the employer would then want to encourage you, if they have more than 20 employees, to go ahead and get on Medicare and let their insurance coverage be the secondary.
And a lot of them do that. That's exactly right.
Okay.
It's not uncommon at all.
All right, fascinating. All right, so okay, now Part D, that's prescription drug. What's my premium for Part D?
Dean, I tell people that from a budgetary standpoint, they should budget $25 a month per person for Medicare Part D. There are some extremely good plans that are less than that, but I always encourage people to budget a little higher than what reality may come in. As I'm sitting here thinking about our conversation on Part D, there's a piece that I want to make a point of. And this is one that if you're talking to an insurance company about Medicare Part D, they should, and I hope in all cases they do, but I'm told in some situations they don't. A Medicare Part D carrier, their coverages, they do not have to cover every prescription drug. For example, let's say that there's 41 high blood pressure medications. CMS is not going to require that carrier to cover all 41 of them. They're going to require them to cover a substantial standard level, and that may be 20. It may be 30. It's going to vary depending on the prescription. So the carrier that you're looking at may or may not respond to the specific brand name coverage or prescription that you're taking.
Okay, so this is tricky.
And it gets worse.
Well, hang on a second. I just want to, this one piece is really, so you're telling me that if I had a Part D coverage, and right now I'm taking no prescription medications.
Right.
And something happens, and then I got to start taking prescriptions, but it just so happens that one of the prescriptions that the doctor thinks is what I need in order to stay healthy or to stay alive, this particular Part D additional coverage that I purchased may not pay for that prescription?
That's correct.
And when can I go find another one that will?
Yes, during the annual open enrollment period.
Okay, so I can't just do it immediately. So no. I could be out of pocket a substantial amount of money for a period of a year.
You could be. And that's the point I want to make. We have a mutual client that has a prescription, and for the she's tried all the generics, and she's tried the lesser expensive choice alternatives to this one prescription. And the prescription that she takes is extremely expensive. The brand name is extremely expensive, and there is no Part D carrier in our marketplace that will respond to that one specific prescription. Now, she can make an appeal to the carrier and the appeal will also include information from her provider, from her doctor, and the carrier could very easily make an exception and cover that. Their interest is the Part D carrier's interest is if they can take a generic for a 90th of the cost and satisfy the need, then that's what they want them to do. And it may be a situation where a Part D carrier will ask the patient to try a couple of alternatives. And if that doesn't work, then the appeal process.
How long can that appeal process take?
It will be very quick.
Okay.
It'll generally be 10 to 14 days.
Okay.
But any appeal process, the answer might be yes, but the answer also might be no. And when I say it gets more complicated, well, so back up. What am I saying is, could a prescription that your doctor, the person that knows you best and knows your healthcare needs best, prescribes for you, could a Part D carrier say, we're not going to cover that? And the answer is yes, that can happen. Very rarely will you be in a situation where that occurs, and then you have the appeal process. And based on the information from the provider, in my experience is frequently the appeal process results in them covering that cost. But there's a second piece to this that makes it even more complicated. In the old days of healthcare,
I'm getting a headache with how complicated this is.
And people wonder why this is so confusing. And obviously, it is confusing. And if our government had set out to make this the most confusing and important coverage for people in our age group, they would get a gold star. They couldn't have done any better. But Dean, it's my sincere belief that was never our government or Medicare's intention. Lyndon Baines Johnson in 1965 signed the Medicare Act. 1965. A lot of administrations have come and gone, and a lot of changes in healthcare have come and gone. And it has developed into a very complicated system. And it's not by intent, it's not by design, but you're right, it can give you a headache. And it can also keep you awake at night worrying about, did I make the right choice? Is there something I don't know? And that's kind of my segue into the second half of why this is confusing. In the old days, prescriptions came to you in the form of either generic or brand name. And the insurance industry figured out that that's really not a broad enough separation of drugs based on cost. There's now 5 tiers of prescription drugs.
Okay.
There is generic, which is the least expensive. The insurance industry calls preferred generic, and I choose to refer to it as low-cost generic and high-cost generic. Then there is brand name. There's preferred brand name. And again, it's low-cost brand name, high-cost brand name. And the insurance industry recognized that some name brand prescriptions are less expensive than some of the generics. So that it depends on what tier that they place that medication in. And then to fill that out, tier 5 is the very high dollar injectables that you'll receive in a physician setting or a hospital setting that's may or may not be covered under Medicare Part B. So you have 5 tiers of prescriptions. And a Medicare Part D carrier makes the determination on which tier a specific prescription would fall into. So let me translate that into a person like myself that's trying to decide, what am I going to do for Medicare? And yes, I take prescriptions because almost all of us in this age group take some form of prescriptions. It's part of the reward or the penalty for living this long. So if I have my 5 prescriptions that I need to take, I want to know, if I can, which Medicare Part D carrier most closely matches based on their formulary. Do they cover all 5 of my prescriptions? And if they do, which tier will those prescriptions fall into? Because a tier 1 is going to be the least copay. A tier 4 is going to be the most expensive copay. And where does this prescription drug company how do they list the prescriptions I take in their formulary? And there's a wonderful answer for this. You can go to Medicare.gov, which is an extraordinarily wonderful, useful health website provided by Medicare. You can put in your name, you can put in your zip code, you can put in your Medicare ID number if you already have it, it's not required. You can list the 5 prescriptions in my example that I'm currently taking, and you can click on pick a plan. And Medicare is going to give you a descending from the least expensive to the most expensive of the carriers in my marketplace, the choices that I have in my marketplace. Remember, I mentioned that for what's going to happen in 2020 has to be approved. It's submitted in May of 2019. And Medicare has all the information from that Medicare Part D carrier. Do they cover this? What prescriptions do they cover? And what tiers do they fit into their formulary? And they build that in their system. So Tom Allen lists his 5 prescriptions. I click pick a plan, Medicare Part D, and it's going to tell me which plan in my marketplace most closely matches my prescription drug use needs and what the tier cost will be.
Wow.
So it's an important tool.
Okay, so but that still may not help you. And it's interesting how this discussion is lining up with a conversation on an earlier podcast that I had with a lady by the name of Bree Williams, who's a specialist on the cognitive effects of aging and how people begin to lose their ability to make decisions or discern things or really understand things as they get older. And what is striking about this whole conversation, Tom, is that at a point in our lives where our ability to make these decisions and understand this becomes more difficult, it seems as though the process is more difficult. So I think it would be critical that you have adult children or somebody else there alongside you, a professional such as yourself, to say, hey, let's help me decipher what I've got going on here so that I make sure that I'm making the right decision.
Dean, that's exactly correct. I couldn't have, exactly correct. Having family or friends or members from your church, caring neighbors, or having people such as myself that can sit down and help you make this decision, because it's not a decision you make this year for the rest of my life. Your prescription drug coverage and using, going back to Medicare Part D, your prescription drug usage is going to change as we develop over years. Some of them will go away and there'll be new ones coming in. So as we lessen our ability to make these sharp individual decisions, it's real important to have someone you can turn to. And there's a lot of people that do what I do because we really enjoy it. I'm fortunate to be in a position in my life where I don't have to worry about my house payment and I don't have kids to feed. And it's important to me to have people know that what best fits their needs and what best fits their interest is the only thing I want to talk about. I don't have an agenda. I don't care which carrier you go with. If you sell 20 policies and you get a free trip to Maui, well, I don't need the free trip to Maui. I need to sleep at night knowing that the person I talk to has the best coverages that fits their needs. So the only agenda that people in my field that do what I do, the only agenda we have is what's best for that individual. Compensation is not a consideration, and the trips to Maui are not a consideration. It's important that those people know that the person they're talking to is giving them sound advice.
All right, so let's continue on and figure out how much more time we're going to need to talk about the different things. So we got A that we talked about, B, we've done D, but you said that was really, we're just getting started. What else is there?
Well, there's Medicare Part C.
Okay.
Medicare Part C.
But D comes before C. Is there a reason you did that?
It just came out that way. Medicare Part C, most people do not recognize Medicare Part C, but they recognize the term Medicare Advantage Plan. And Medicare Advantage plans for people in our age group, there must be ways for carriers and providers to find out when people are nearing 65 and moving into the Medicare consideration time period. And I base that on the fact that once you get close to that time period, 4 or 5 items out of every 6 or 7 items in your mailbox is going to be a Medicare Advantage advertisement. During the annual open enrollment period, which is October 15th through December 7th each year, the majority of the commercials you're going to see on TV are on Medicare Advantage plans. And Medicare Advantage plans, Medicare designated that Medicare Part C. And the genesis of that goes back to the late 1990s. Medicare recognized that they had a significant problem coming down the pipeline, the baby boomers.
It was at the administration of the whole process of, is it that the processing of all of the healthcare claims and things?
Exactly. CMS, Medicare, recognized that there's going to, the baby boomer generations were starting to hit maturity. They were starting to age into the 65 Medicare type considerations. And Medicare recognized that they could staff, they could computerize, they could office for this large glut of people that were going to come down the pipeline. But they also recognized that there was going to be a beginning of this large group of people, and then there was going to be the tapering off as they went through the system. The baby boomers ended in 1964. People born after 1964 fall into a different category. So Medicare recognized that they could staff and they could computerize and they could office for this large group of people coming through the pipeline. But they knew at one point in time that they would have too many staff, too many offices, too many computers. So they went to the private insurance industry and asked a simple question. Can we contract with you? Can we lease your capabilities to absolutely match everything that Medicare Part A and Medicare Part B does for a certain amount of money? And the private insurance industry said, yes, we'd like to sign that contract today, and we'd like to start seeing patients tomorrow. And Medicare said, you really said yes, really quick. And the private insurance industry said, yes, but we're going to make a lot more profit. We take more risk every day for less income than what you're offering us. So yes, we're very, very interested in doing this.
That's interesting. So it was really Part C then is the Medicare Advantage Plan, and it's all about using the private insurance industry to basically process the claims.
Well, to act on behalf of Medicare.
Yeah.
Process the claims, do customer service.
So what's the downfall? What is the downfall to the Medicare Advantage? Well, first of all, the Medicare Advantage Plan has no premium because what happens is the government is paying the insurance company to process the claims and to take care of this, right? So the Medicare Advantage Plan has no premium, but there's a maximum out of pocket. Is that the deal?
Yeah, yes, it is. And there in our marketplace, there are some Medicare Advantage programs that have a very small premium. But by and large, most of them are premium free. And in most cases, they also include Medicare Part D. So a Medicare Advantage plan in our marketplace is giving you Medicare Part A, Part B, and Part D, and in most cases for a zero premium. So
I like it.
Well, yes, but early on, and Dean, maybe the difference in our age group, early on, people in my age group said, this is too good to be true. And our government's telling us this is true, and we kind of tend not to buy into that notion. So early Medicare Advantage plans early on did not sell well because it was too good to be true. Over time and our experiences, the Medicare Advantage plans are now covering about a third of the Medicare eligible population, and they're growing rapidly.
So when would I go straight for a Part D plan from an insurance carrier versus just going with the Medicare Advantage plan?
Same answer. When you be first come eligible for Medicare.
And but how would I choose one over the other, Tom? That's my question. And why would I pay an insurance company for a Part D, which is going to cost, I don't know, what's my average premium on the Part D? A couple $100 a month, or
$25.
$25. Okay.
Okay. It's more than just the part. The consideration, in my belief, is that it's a lot more than just the Part D coverage. Medicare Advantage plans with a zero premium, and let me back up. When we say there's no premium, how can there be no premium if I'm getting Part A coverage, Part B coverage, and Part D coverage, and there's no premium? And the answer is Medicare allocates a certain amount of dollars each month based on your gender, based on your zip code area, and recognize it's a lot more than that $135.50 that you're paying in for Medicare Part B. And to purchase a Medicare Advantage plan, you must have and must maintain Medicare Part A and Part B coverage. So from a threshold standpoint, you're going to be spending $135.50 currently for Medicare Part B, and you must have that in place to be eligible to accept or purchase a Medicare Part C, Medicare Advantage plan. The Medicare Advantage plan covers the word advantage, Medicare Advantage plan. And let me wind my conversation back a little bit. When Medicare asked an insurance entity, national insurance entities, if they could lease them, if they could use them to act on behalf of Medicare, they allocate so many dollars a month based on the assumption of claims that are going to come in for that person that month. And what I read tells me that's in the $600 to $700 to $800 a month based on geographic locations and gender. So every month that Tom Allen is a member of a Medicare Advantage plan, that Medicare Advantage plan is going to get $600 or $700 or $800 a month from Medicare, but they're going to be responsible for paying my claims. They're going to be responsible for customer service, printing ID cards, all the aspects of coverage. And the conversation I had about Medicare Part D, where you would look at the formularies.
So let me make sure I understand what you just said.
All right.
You said that the government is going to pay the insurance company $600 to $800 a month. You're paying the $135.50. So the government's actually coming out of pocket. But when a claim gets filed, the insurance company is on the hook for whatever the claim is.
That's correct.
But it's got to be the Medicare approved amount that the insurance company will pay.
And it has to be a Medicare approved coverage.
Gotcha.
Interesting.
So they're shifting the risk to the insurance industry.
Yes, exactly correct. And
which is why they're pushing the Medicare Advantage plan then.
Well, and for the Medicare Advantage carriers, it is an extremely profitable line of business.
I get it. It makes sense to me.
And recognize that the $600 or $800 that's going to be given to a Medicare Advantage plan, if the Medicare Advantage plans had not come about, Medicare would be allocating those dollars for each person in that zip code of that gender. So it's worked very well. Prior administrations have looked upon Medicare Advantage plans, Medicare Part C, and talked about maybe this was an expense that they could remove and shift back to Medicare. And the reality is they're saving money.
Right. So in other words, it seems to me it's a lot like a company that decided they were going to self-insure, and then they decided, well, self-insuring really isn't what we thought it was going to be. Let's shift that risk back over to the insurance company, and that's what the Medicare Advantage plan is. And that was done late 90s?
Yes, that's exactly right.
All right.
And part of the name Medicare Advantage plan, let me back up slightly. To offer a Medicare Advantage plan, they must provide exactly what Medicare Part A and Medicare Part B does. And when they were negotiating early on with Medicare, with CMS for coverage, Medicare said, there is a profit cap. You cannot make, the fact that they said yes so quickly made Medicare come back and say, do you realize there's a profit cap? And the private insurance industry said, we're going to make more profit on this line of work than what you're allowing us. You're asking us to be as inefficient as an arm of the federal government, and recognize that we are an investor, shareholder, stockholder owned company that must run an efficient, tight, clean operation. And we're going to make more profit than traditional Medicare would. And the private insurance industry said, let me back up. Medicare said, we limit the amount of profits you can make. And conversations pretty much came to a standstill. Medicare came back and said, what if you just charge everybody an individual premium? And the decision was made that was probably going to fail. That was probably a situation that would not work out in even the short run. Conversations pretty much stopped, and one national insurance entity went back to Medicare and said, okay, what if we offer additional benefits on top of what Medicare A and Medicare B offers to stay under the profit cap? And Medicare said, we like that notion. We like that idea a lot. Medicare said the first thing that we're going to require is that there's going to be an annual maximum out of pocket. And this is a good point to tell you that a Medicare Advantage plan, in most cases, not each case, but in most cases, has no deductible. They have a series of copays. Using one of our marketplace larger carriers, if I see a primary care physician, I pay a $25 copay. If I see a specialist, I pay a $50 copay. If I go in the hospital, I pay $315 a day for the first 5 days of hospitalization. Wellness is covered at 100%, so I get that without a cost. But each and maybe a CAT scan, maybe a $90 copay. Each and everything you have done has a small copay associated with it. And Medicare said we want an annual maximum out of pocket. When your copays hit this amount of money, then you're going to be responsible for picking up 100% of that. And
expense. What is that out of pocket?
In our marketplace, painting with a slightly broad brush is $6,500
Per person?
per person per year.
Okay.
And yes, I could write a check for $6,500 and it would clear and I wouldn't smile. But $6,500 is how high the ceiling is for me on looking at healthcare costs for a calendar year. Having said that, of the now 19 or 20 million people covered under a Medicare Advantage plan, less than 1% hit the annual maximum out of pocket. So my maximum out of pocket ceiling is $6,500, and I stand at less than a 1% chance of hitting that. I like that a lot. And for zero premium, I've just protected my assets.
Mm-hmm.
We're coming back to our earlier comments. I can protect my assets. I can ensure good quality health care when I need it for a zero premium.
Okay.
What's not to like? And it's
so you said earlier this is too good to be true. Let's see if we can put a bow on this thing and say, all right, how do I choose then? Why do I go out and buy that Part D? Because if I got to go out and pay for a Part D, or I can go to the Medicare Advantage, which is going to include prescriptions, why would I go pay for Part D?
Well, Dean, there's a third page to this. Paul Harvey would say page 2. I've got to say page 3. There's another choice we haven't talked about, and that's a Medicare tie-in plan or a Medicare supplement plan.
Okay.
They all mean the same. When Lyndon Baines Johnson signed the Medicare Act in 1965, the private insurance industry looked at the coverage and they said, well, this Medicare doesn't cover everything. Medicare Part B covers 80% of the cost, and the patient pays 20% of an unknown amount of money because we don't know what the bill is going to be this year. And so the the insurance industry created what was called a supplement plan to supplement Medicare.
That's what you call your Medicare supplement policy.
Yes.
But isn't the Medicare supplement policy really the same thing as the Medicare Advantage plan?
No, it's the second choice. It's an alternative choice. You cannot have both.
Well, I understand that, but I mean, don't they both essentially do the same thing? They pick up where Medicare leaves off?
Yes. Oh, sure. Yeah, I see what you're saying. Yes, that's exactly right.
But one I have a premium for and one I don't.
That's exactly right. But recognize Medicare Advantage plans didn't come around until, the late 1990s, the early 2000s. Medicare Advantage plans are the result of a need because of the baby boomer generation hitting the pipeline.
I get it.
In 1965, when Medicare was first passed, the private insurance industry recognized that they had an opportunity to come up with a product to fit in with.
They're going to take the risk where Medicare leaves off.
Medicare will under a supplement plan or a tie-in plan or a Medigap plan, all three mean exactly the same thing. Medicare is going to pay what it's going to pay, and then your supplement carrier is going to pick up part of, or most of, or all of what's not covered, depending on which tier, which level you purchase. So that's what we had. We had Medicare in 1965. We could purchase a Medicare tie-in supplement plan, Medigap plan, to offset the expenses that weren't covered by Medicare at a premium, and that was our choices until Medicare Advantage plans came around 2000. A tie-in plan is by a private insurance industry. You must have Medicare Part A and Part B and maintain Part A and Part B to be eligible to purchase a supplement or tie-in plan, and there's a monthly premium. And
are the monthly premiums reasonable? What do we got there?
Well, the monthly premiums can be reasonable.
I have deductibles? And how does this how's this thing work? So let me here's what I want to see if I can cut straight to it. If I get sick and I've got a Medicare tie-in plan or a Medicare supplement plan, whatever you want to call it, versus a Medicare Advantage plan.
Yes.
Okay. In that year where I got sick and I met my $6,500 out-of-pocket maximum on Medicare Advantage. Is that going to be more expensive for me that year than the tie-in plan would be, or is it going to be about the same?
Well, it depends, and I'm trying to determine how the best way to answer your question is. Under a Medicare tie-in plan, supplement plan, when Medicare first came out, there were probably 2,000 insurance companies plus in this country selling health insurance. Now there's under 10, but at that point in time, there were a couple thousand, and all of them came out with their choices on a Medicare supplement plan, which translates into, let's assume that there were 5 or 6 choices from each carrier times 2,000 carriers. You had 8 or 10,000 policies to choose from, and if a person chose the right one, it would have been accidental. I'm sure it may have happened, but it probably didn't. The government stepped in and said, we're going to standardize this. This is too confusing. This is an age group that deals less with confusion than perhaps a younger person. So we're going to standardize the coverages, and they gave a coverage designation of A through N. Now, don't confuse that with Medicare Part A or Medicare Part B. This is a whole nother set of choices that have exactly the same name. You can have a supplement plan A, which is the least expensive and provides the least amount of coverage. The plans that cover the greatest amount of coverage is the F tier or the G tier. And the government they standardized what the benefits were going to be under each of these tiers, each of these sets of choices. They don't care what a carrier charges. But if you're looking at a Medicare supplement F plan, it makes no difference which carrier you purchase that from. They are going to be exactly the same coverage.
Okay.
Premium may vary, but they're going to be less coverage. And so in our marketplace, for an F or a G plan, which is the highest tier of coverage, I tell people to budget about $150 a month premium.
Per person.
Per person. That's on top of, they must maintain Medicare Part B, which is $135.50 this year.
Right, but what I want to do here, Thomas, I don't want to get confused. I don't want people to get confused because to me, you're going to pay the $135.50 regardless
That's
of
correct.
whether you have the Advantage plan or whether you have the Type F supplement.
Right.
Right?
Yep.
The difference is if I go get a supplement that's an F plan, I'm going to pay $150 a month, $1,800 a year. If I don't use it, I'm still paying the $1,800 a year.
Yes, that's right.
Okay, now do I have a deductible with the F plan?
You do not.
It pays for 100% of everything.
The F plan essentially pays for everything that Medicare doesn't.
So you have no other cost for any kind of health care if you have the F plan and you have the A, the B, and the D.
Yes, essentially that's correct. And, to put a fine point on that, the Medicare Part F plan, which is the richest plan, is going to go away January 1st, 2020. Because essentially what you just said is correct. If you have A, B, a D plan, and an F plan, you have no out-of-pocket expense for anything that should come about this month.
You just got your premium and that's it.
That's it.
Paying for 100% of everything.
And the government has a problem with that. They want you to have some cost associated with receiving health care. So the F plan is going to go away. People are going to, the highest tier is going to be the G plan. And the only difference between the F and the G plan is that the F plan pays the Medicare Part B deductible, which this year is $185. So translating that, the government, Medicare, wants there to be some out-of-pocket expense involved in receiving some health care. Although it's going to be very minor, they want the patient to have some cost of receiving health care, or they're afraid there'll be overutilization if it's absolutely no out-of-pocket cost. So
then how do you determine which one's better? How do you determine what should you do? Because as we were talking about the Medicare Advantage plan, I'm thinking, well, that's a no-brainer. Let's just use the Medicare Advantage plan. But now you're saying the F plan would have been a better deal because maybe, I guess it depends on how many years you can go without having to use the Medicare Advantage plan, right?
Well, part of this is a mindset. What I've portrayed for your mind's eye is with a Medicare Advantage plan, you have zero premium and you have a series of copays with a maximum that's hardly attainable.
But you're saying that only 1% of people that are on the Medicare Advantage plan ever hit that max. Is there an average, national average that people hit on that copay?
If there is, I have not read it.
Okay.
But that you're paying a little copay for each service that you have done. So it's a pay-as-you-go or a pay-as-you-use
So I guess
system.
so I guess the question is that copay going to be more than the $150 Medicare supplement policy?
It's my experience. It's not. It's really a mindset. If a Medicare Advantage, let me say the opposite. A Medicare tie-in plan, and if you went with the F or G, the higher tier premium, and you paid $150 a month, and then you have your Medicare Part D at $25 a month, you're spending $150, $175 a month for that coverage. You're prepaying what healthcare costs you might need. And you're right, your point's accurate. If you didn't get any healthcare that month, you paid $175 for nothing. And I would argue, no, you paid $175 for the ability to sleep 31 comfortable nights, knowing that you cannot be financially destroyed. Your assets are protected, and you're going to have the healthcare coverage you need. To contrast that with the Medicare Advantage plan, it's a pay-as-you-go. $25 for an office visit, $90 for this step, $315 for the first 5 days of hospitalization. Every month under a Medicare Advantage plan that you didn't receive health care, you didn't pay anything. So one is prepaying your health care cost, and one of them is more as a pay-as-you-go.
Right, but you still are going to have a maximum out of pocket in an individual year that Medicare Advantage plan could be. All right, so I want to see if we can wrap this conversation up. If you think we're to a point where we can do that, and I want to do it by just asking this question. Assume that I'm 64 years old and I need to get on Medicare next year, or I'm going to be 65 in a few months. At what point should an individual seek out professional help like you, Tom?
I suggest about 90 days before before they're eligible for coverage. Recognize that people in my position cannot provide a Medicare tie-in plan or a Medicare Advantage plan until that person has Medicare Part A and Part B in place. So,
right now, so the first year they don't have to wait for that open enrollment period, right?
That's correct.
In the first year, if let's say that I turned 65 on January 1st, I don't have to wait until October 15th for the open enrollment period to get on to find my Medicare Advantage plan or my Medicare supplement and sign up for Medicare. I can get on Medicare and get that tie-in plan right away.
Exactly correct. That is your initial enrollment period, and turning 65. And you have about 90 days before you turn 65. I would encourage you to contact Medicare and tell them that I want Medicare Part A, I want Medicare Part B, and my birth date is June 7th, so it's going to be, the coverage is going to start on June 1st. It's always the first of the month of your birthday, unless you become eligible if you were born on the first of the month, it's the first of the preceding month.
Interesting.
There's always little pieces that make this tough. A point that I want to make, and I didn't, with a Medicare Advantage plan, there's one question for underwriting. And that question is, doesn't matter if it's your initial enrollment period or the annual enrollment period, do you have end-stage renal disease? If you do, you are not qualified to purchase a Medicare or take a Medicare Advantage plan. Now, there are other federal programs that far exceed anything we've talked about today that you will be eligible for. And you're probably already aware of that because of being diagnosed end-stage renal. But there's only one question for underwriting for a Medicare Advantage plan. With a Medicare tie-in plan, you have 6 months from the date you receive your Medicare Part B where there is no underwriting. And they take you with every wart, every bump, and every problem that you would have because they don't know it, because they never ask a question. But if you want to enroll in a Medicare tie-in plan after that 6-month clock has expired, you have full underwriting.
And so every enrollment period after that, you have full underwriting? Or that's one of the penalties if you didn't get it right after that 65th birthday.
Right. They're going to underwrite it. And there's a lot of people that will go with the Medicare tie-in plan because they recognize the health issues that they currently have are going to keep them from ever qualifying to take a Medicare tie-in plan unless they do it during their initial enrollment.
So it's really critical then that somebody, I don't know that 90 days is enough time for somebody to talk to you or somebody in your position, Tom, to really truly understand and weigh out all the different options, because it's really going to depend on what's going on in their life and their current health status.
And And Dean, you're right. If you're in a situation where you have a very complicated set of circumstances, by all means, give us a call, give me a call.
Because these aren't things that I think I couldn't make an instantaneous decision after having a half hour, 45-minute discussion. I mean, I'm going to need to process this stuff, and probably what's going to happen is, and maybe this is what happens, we're going to have a discussion, and then there's going to be, oh my gosh, that just brought up 100 more questions.
Real common.
Yeah.
It's and in fact, when a person says after an initial conversation, I think this is what I want to do, I always encourage them, unless we're just absolutely with our back against the clock, I encourage them not to make a decision, to go think it through. New questions, as you pointed out, are going to come about, and we need to sit down and kind of walk our way through what's best for them. I some people would have to say that I sell these products, and therefore, if I do, I'm a salesman. But Dean, I really, truly, and I know this fits under Barber Financial's mantle, I really consider myself an educator.
Right.
My job is to give you enough information where you can say yes, no, maybe, oh yes, this is the one. And that requires education. And so your point, how many meetings do you need to have to get to that point? Depends on the circumstances.
Well, Tom, think about our whole guided retirement system. This is a journey, and if you want to have the best experience on any journey, whether it be a vacation or wherever it is you're going, a good guide is really what you need. And, a guide not just on the investment side of things or the tax side of things, but the risk management side of things, and especially as it pertains to healthcare. So I want to thank you for taking some of your time and spending with me here on the Guided Retirement Show to help people better understand the complicated nature of Medicare supplements, Medicare Advantage plans, and I'm sure we'll do this again. There's things that I'd like to ask and some additional things, and so I'm sure we'll have you back on here again.
Look forward to it.
All right.
Thanks. Dean.
Who would have known that a couple of guys could have an hour-and-a-half long conversation on Medicare and still not touched everything? We've got a lot more to talk about on Medicare. We'll make sure and get Tom Allen back on here in the near future for more on the Guided Retirement Show. You can find links to this episode's show in the show notes and also the giveaways in the show description, or you can also visit us at guidedretirementshow.com/7. That's guidedretirementshow.com/7. Also, make sure that you subscribe to the Guided Retirement Show and share this with your friends. Everything about retirement, it's all about guided retirement. We are your guides for a successful retirement.